Well, thank you, Mr. Chairman and committee members, for inviting me. I'm Scott McCown, and happy to be here to talk with you today. I've been at this since 1989. I started as a state district judge and have heard an incredible number of child abuse and neglect cases. I provided policy analysis to you over at CPPP on child welfare, and now I'm director of the Children's Rights Clinic at the University of Texas School of Law, where we actually have third-year law students who represent children in CPS cases as their attorney guardian ad litem. So I'm on the ground and have a good sense of where we are. I know that you must be incredibly frustrated, as am I. I know that you have been more generous in your funding of child protective services than any other social service area, and yet year after year there's problems. And I will say to you that the system is more in crisis now than any time in my years since 1989, and it's going to take some big steps to fix it. I have some written testimony with some graphs and charts attached, but I'm actually only going to make 2 big points and 2 little points, so 4 points on all, and I'll be fairly brief. And I'll start with your interim charge on fatalities in foster care, which of course we're all very concerned about. And that brings me to my first point. The key to almost all of your problems is lowering caseloads. And we had an interesting discussion about how you talk about caseloads, and the department actually has a logical way of doing it. When you ask a janitor what his caseload is, you would count classrooms. Because he's cleaning a classroom, you count classrooms. When you ask a teacher what her caseload is, you would count students, not classrooms. And so that they have a caseload definition, and it is a little confusing until you get used to it. But however you tailor it, our caseworkers carry way too many cases. And that's what the federal court found in its recent ruling that we had an unconstitutional system. Caseloads are simply too high. It doesn't matter what new laws you pass, what new tasks you put on caseworkers. If they can't do it because they're responsible for too many cases, then it's as if it was never done, is never passed. So why are caseloads too high? Well, there's a simple reason. We do not pay enough to attract and retain caseworkers. And I'm going to bring you a great Republican argument, which is the free market is screaming at us. The free market is screaming at us that we are not paying enough for these jobs. The department has 400 positions right now that it's struggling to fill, that it can't fill because entering salaries aren't high enough. Annual turnover for caseworkers is 25%. We pay $34,000 to start. Compare that to a teacher who works on a 9-month contract, not a 12-month contract, who makes roughly $40,000 to start, or a Department of Public Safety trooper trainee, the day he walks in the door, makes $55,000 to start. Now, there's a debate in the legislature. Well, is it pay or is it working conditions? Well, we know it's working conditions for a couple of reasons. First, employees tell us that it's working conditions. They tell us pay matters. In every state auditor exit survey, pay ranks number 2 in why they're leaving. Secondly, the department, and they're going to be mad at me for getting ahead of them on this because they haven't released it yet, but the UT has done the UT Organization for Excellence has done a survey. It's hot off the press. And caseworkers say that they're not paid fairly, they're not paid enough, that they would leave for 10% more money, and that they feel pretty neglected by the department, even though they highly identify with the department's mission. So we know that pay matters because we hear it from employees. But second, working conditions are a key reason that they're leaving. But you can't improve working conditions until you reduce caseloads. It's the high caseloads that create the bad working conditions. The supervisors can't be good supervisors because they too have huge span of responsibility. And so we have to reduce caseloads to improve working conditions. And so how do we do that? We increase pay. Now there's 2 difficult things about increasing pay. The first difficult thing is if you increase it $500 and $500 isn't enough, you've just wasted $500. So you've got to increase it to an amount that's going to get the job done. And unfortunately, that brings me to that second problem. That's going to be hundreds of millions of dollars. If you want to be serious about this, an increase is going to be hundreds of millions of dollars for pay. We do know, though, roughly what that amount is. We've actually done an experiment. So in the Midland area, during the fracking boom, when there were jobs everywhere at high pay, the department couldn't keep people. And so they got permission from the legislature, they raised pay $1,000 a month. Turnover dropped 43%. You cut turnover 43% in the midst of the fracking boom in Midland by paying $1,000 more a month, which would bring you up it'd bring you up roughly to what a teacher would start at on a 9-month contract. These are very dangerous jobs. They're very difficult jobs. They require high skill, and in terms of fairness and mission accomplishment, we got to do that. Now, there will be a big cost offset. I'm turning to Representative Price to reassure him because he's thinking, my God, that's a lot of money. There is a huge cost offset. It costs $54,000 to train and deploy a caseworker, and when you're losing 25% of them a year, that's a huge amount of money that you're losing. So I'm not the person to run the numbers and give you a fiscal note, but and I know you're not the Appropriations Committee, but what I'm here to tell you is nothing you do or require or mandate is going to make any difference if caseworkers have caseloads that are so high they can't get it done. The only way to reduce caseload is to reduce turnover, and the only way to reduce turnover is to pay a decent salary that attracts and retains the staff you need. That brings me to my second big point, which is foster homes. And I left out one thing when I was giving you my credentials that's probably taught me more about this area than anything I've done, which is that my wife and I adopted a 12-year-old out of the foster care system. So I have experience, as some of y'all do, in working in this area and kind of have an idea about what the problem is. So right now in Texas, we have a capacity crisis. This is a really serious crisis. And I don't want you to have the impression that it's just about high-needs kids, because it's not. We have a capacity crisis at every level in our system. And because we don't have a robust basic foster care system, we are creating high-needs kids. Some kids walk in the door with high needs. They have medical needs or psychiatric needs or severe behavioral problems before CPS ever sees them. So some kids walk in the door with high needs. Some kids walk in the door and they're a troubled kid in a tough situation, but they're not a high needs kid today. But when you bounce them from home to home to home, they become a high needs kid. And so we have to increase capacity at all levels. It's not just about high needs kids. We've got, on any given night, 20 kids sleeping in state office buildings. Now, I want to address Representative King's point, because I think she made a very important point to reassure the public that the department is responsibly taking care of these kids in state office buildings. They do the best they can. But that is a huge problem. I don't want anybody to go away thinking, well, the department's housing kids appropriately in state office buildings. If you weren't the state of Texas, that would be a misdemeanor offense, the way you're housing kids under the penal laws, because you're not meeting the minimum standards for emergency shelters. And it would be the only reason it's not a misdemeanor offense is because you've made an exception for the state. So this is a serious problem that tells you, it's kind of a tip of the iceberg problem that tells you that down below we've got really serious problems in basic homes, in treatment homes, in group homes, in residential treatment. The other thing that hasn't been mentioned yet is we've got kids stuck in psychiatric hospitals who are ready to be discharged but have no place to go. And that is the problem. Well, why is that? What could we do about that? Well, the problem is the provider rates that we're paying. It's the child placing agencies The state of Texas is almost completely out of the foster care business, and the plan is to get out of the foster care business. So it's all done outsourced to child placing agencies. They recruit, they investigate, they train, they deploy, they monitor, and they provide support to the foster home. We only pay 80% of the documented cost for them to meet their state contract. Well, where does the other 20% come from? Well, what you hear is that the other 20% comes from philanthropy, and that's not completely true. Philanthropy pays some of it, but what actually happens is a lot of what the contract requires to get done just goes undone. They just don't do it. And kids' needs aren't met. We cannot count on philanthropy to pick up that 20%. Philanthropy, faith-based charity, is a limited amount of money. It's an uncertain amount of money. And it should be going for enrichment of children's lives, not for paying the basic care that the state contract says you have to provide. And the other thing is, I may be able to cover 20% of your cost today, but if you need to expand, your cost becomes greater. I can't continually cover the 20% of the expansion. And so what we basically have, and I mean this is just a tough way to put it, basically the free market is screaming at us once again that we're not paying enough because providers they're saying no. They're telling us no. And we do need to make it easier to recruit foster parents and to get them into the system and to make their lives easier. But I want to disagree. It's not primarily a paperwork problem. We do need to do that. But the kids that are in our system are extremely troubled, and foster care today is different than foster care in yesteryear. Foster parents are part of a professional treatment team that's dealing with a kid that suffers from severe trauma and has a lot of acting out, and we are asking foster parents to do an amazing amount of work, and yet we're not providing that administrative structure to recruit, investigate, train, deploy, monitor, and support. Now, if things weren't bad enough, I want to flag for you that we've got 3 serious problems that are fixing to hit us. First is the one that Representative Keogh pointed out. This federal injunction against foster group homes resulted in an immediate loss of capacity. And so that's part of our problem. It's not the primary problem, Representative, but it is part of our problem. Second, the federal court said, rightly so, that your licensing division is not tough enough on your foster homes. And that's something that you, the legislature, have said as well. And in fact, you've asked for licensing to be moved away from DFPS over to Health and Human Services Commission to make it more independent and more aggressive. Well, what happens when licensing gets more independent and more aggressive and goes out and closes those bad foster homes? You don't have capacity. You have lost 200 residential treatment center beds in the last few months because licensing has closed at bad residential treatment centers. Well, so those are beds you don't have. And then the third thing that's facing us is the Families First Act, which was mentioned, which has passed the House. It's pending in the Senate. Different people say it may or may not pass in this Congress, but it's not going away. It's going to come back, and it's going to pass eventually. And what the Family First Act does, new federal law, is it severely restricts what's called congregate care. And basically, congregate care is anything but a foster home with 6 or fewer kids. So if it's anything that's not a foster home with 6 or fewer kids, the feds aren't going to pay for it anymore. Well, that would be a huge hit to our capacity. The department did a study that showed on August 31st, just a snapshot, August 31st, 2015, out of about 17,000 kids in state-paid foster care, we would have needed new homes for 3,000. And it has a very short implementation window. It has to be implemented in just a few years. So it may not pass this Congress, but it's not going away, because what the science tells us is that keeping kids warehoused in big institutions is a bad thing, and that you need strong foster families. Well, how do you get strong foster families? Think about the problems, the differences in a new couple starting out, and say my wife and I. Nowadays you got to have 2 incomes. You've got to face the traffic, the urban traffic, getting kids hither, there, and yonder. And you've got kids with more difficult problems and needs. And you're being asked to do more. You're being asked to work with biological families and engage with relatives and facilitate visitations and transport kids. We want more. We demand more. And so recruiting those foster parents, as our baby boomers age out, we're facing these baby boomers aging out of foster care, recruiting those foster parents, training them to meet the modern needs, and then monitoring and supporting them is a huge job. And we're only paying 80% of what we require an agency to do in our own contract. So this is another several $100 million item. So those are my 2 big points. Both of them several $100 million items. And I'll just say to you that I have been so disappointed. The level of dialogue and urgency that we're bringing to this problem in this state does not match the size of the problem and what's happening to the kids. And so we have to start thinking about how we're going to pull together, $400 or $500 million to fundamentally reshape this system. So my 2 little points. I'm getting now to the 2 little points. First, foster care redesign. Foster care redesign is really promising, and this is the program up in Fort Worth. It's performance-based contract, it's managed care, and it's showing some amazing progress. I mean, outcome measures, not process measures, but really things happening that are good for kids. So I support continuing to extend foster care redesign. What I'm going to tell you that's going to be a little bit different than what you've heard, may hear from some others though, is that project, the department picked the best place in the state to start. That project is going to take a decade to roll out across the whole state. And it's going to be built on the legacy system. Because when you open up a new foster care redesign program, you're funding it from 2 places: foster care rates and from the staff money you shift from the department over to the foster care redesign. Well, that's why getting salaries up for caseworkers actually helps you fund foster care redesign, because then as you roll it out, there's more money for foster care redesign. That's why getting foster care rates up across the state to build that infrastructure helps foster care redesign. So not only do we need more money for foster care redesign itself, but we've got to get caseloads down and salaries up, and we've got to build foster homes and get foster rates up across the state to make it possible to continue to roll out foster care redesign. You were promised that foster care redesign would be revenue neutral. It is not revenue neutral, and I think y'all recognize that now. But we've got to pay the full cost of foster care redesign, but it has to be on top of raising caseworker salaries and raising provider rates. The other issue about foster care redesign that I know Nancy Holman's going to talk about is, what do you do with case management? Who makes the decisions? Does the private contractor make the decision, or does the department make the decision? And my bottom line is we must have a public caseworker responsible for every child in the state who approves the placement and who approves the plan of service. Now, we can turn a lot more decision-making over to the child placement agency, We can improve communication between the child placing agency, the foster care redesign system, and the department. But ultimately, I would be opposed to turning all that over, and I'll tell you why. We say that performance-based contracting is a great thing because people are motivated by money, and when you provide a financial incentive for contract results, you get results. And that is true. And if all you're doing is making and selling widgets, it works great. But the problem in human services is it's very hard to define the right measure because you want most kids to go home, but not when they shouldn't. You want most kids not to be in an RTC, but they should be when they need to be. And if the person who's making all the decisions has a financial interest in it, that skews their decision making. And that's why that public caseworker is so important. So I don't know if you'll laugh at this or not, but if you had a guy running a private prison and you contracted with him to run the prison, would you also say he could set the sentences and decide parole? Well, we would all be going to prison, and none of us would ever be getting out if he were in charge of doing that. And so I'm all for more say-so for foster care redesign provider and better communication, but that public caseworker is something that I don't want to give up because I don't think it would be good for kids. So that was my little point, my first little point. My last little point is just to say a word about consolidation. You don't have an interim charge on consolidation, but every time I see Representative Forprice, I say consolidation is a bad idea. You've got the department right now with all it has to be doing being involved in this deep consolidation with HHSC. They lost their lawyers, for example. And this is just not the time, if there was ever a time. And the other thing we know from the Department of Homeland Security, bureaucracies get too big. I mean, this agency was once part of Human Services, and it was stripped out because that didn't work. And now we're on the verge of putting it back and making them do all this consolidation. And I think, as you've heard from the testimony today, there's not a clear difference between program delivery and administration. How you do contracts, what kind of paperwork you require, all of that actually is part of service delivery, and yet the department's ability to influence that is shrinking instead of growing. So those are my points. I have written testimony with a lot of graphs, and I'll be happy to answer any questions.
Members, any questions? Good testimony.